Today, I will be acting as the student physical therapist assistant, and we will be performing a wheelchair to walker transfer.
And I'm Christy. I'm going to be acting as the patient.
Okay, awesome. First thing you always want to do is make sure you have a gait belt around your patient, just for safety purposes, so that the patient doesn't fall and they feel secure, and you have some place to grab when you go to transfer, okay? After that, you want to make sure all of the foot supports are out of the way, as well as the brakes are locked on the walker, or the wheelchair, excuse me. After that, you want to make sure the walker's a good height for your patient. Should be to about the greater trochanter of the hip. This one's a little short for me, but it actually works pretty good for Christy over here. Okay? The first step in a transfer is getting a patient to the edge of the wheelchair. So it's simple as just asking them to scoot forward, but if they need some assistance, you can give them some cues to help them. Like, you can lean back in your chair and have them straighten their legs and push themselves forward. Want to demonstrate that? Simple as that, okay? Alrighty. When going to perform the actual transfer, you always want to be to the patient's affected side. So for today's purposes, it'll be Christy's right side. Okay, Christy, so I'll be standing here, get the walker in place for her right in front of her like this. Okay, so what we're going to do next, Christy, is you're going to go ahead and put both your hands on the armrest. It's important not to have the patient grab onto you or any part of your body, because then the transfer becomes unsafe and you can actually fall with the patient. And you also don't want them to reach forward onto the walker, because they can pull that on top of themselves. So the best place in a wheelchair is usually the armrest, okay? So on 3, Christy, you're going to go ahead and push up with your arms and your legs and get into a standing position. Once you're fully in a standing position, you can then reach forward for the walker, okay? Okay? So on 3, ready? 1, 2, 3. Go ahead and grab the walker. Perfect.